Hey there, health warriors. Did you know that nearly 1 in 4 Americans lives with a disability? And in healthcare, it's our responsibility to make sure everyone receives equal access to care without barriers. Today, we're breaking down the Americans with Disabilities Act, or ADA, what it is, how it applies to healthcare, and what every provider needs to do to ensure accessible, respectful, and compliant care for patients with disabilities. Let's dive in. The Americans with Disabilities Act, or ADA, is a civil rights law passed in 1990 that prohibits discrimination against people with disabilities in all areas of public life, including healthcare. It requires hospitals, clinics, private practices, and all healthcare providers to offer equal access to services, communication, and physical spaces. Under the ADA, disability includes physical conditions like mobility limitations and paralysis, sensory impairments such as deafness and blindness, intellectual and developmental disabilities, mental health conditions, and chronic illnesses that significantly limit daily activities. If a patient's disability affects their ability to access or participate in care, reasonable accommodations must be made. What does ADA compliance look like in healthcare? Physical accessibility, ramps, elevators, wide doorways, grab bars, and accessible restrooms. Exam tables that lower and raise. Wheelchair-accessible scales and seating areas. Communication access, providing qualified American Sign Language or ASL interpreters for deaf or hard-of-hearing patients. Large print, braille, or digital materials for patients with vision loss. Use of assistive communication devices for patients with speech impairments. Policy and procedure modifications, allowing service animals in all clinical areas unless contraindicated. Scheduling extra time for patients who need assistance. Offering support persons during visits if needed for comprehension or safety. Staff training and awareness, educating all staff on disability etiquette and ADA rights. Using respectful, person-first language such as person with a disability, not disabled person. Asking before assisting and never making assumptions. ADA compliance isn't just about physical changes, it's about inclusive attitudes and informed care. Why ADA compliance matters? It's the law. Non-compliance can result in legal action, fines, or loss of funding. It also improves health outcomes. Accessible care helps eliminate health disparities. It builds trust and loyalty. Patients are more likely to return when they feel welcomed and respected, and it protects patient rights. The ADA ensures everyone receives equitable care regardless of ability. Providing accessible care isn't a favor, it's a legal and ethical obligation. How to ensure ADA compliance in your facility. First, conduct an accessibility audit. Walk through your facility as if you're a patient with limited mobility or sensory loss. Identify barriers and create a plan for modifications. Second, establish clear policies for accommodation requests. Know how to request interpreters, adaptive equipment, or longer appointment slots. Make sure front desk and scheduling staff are trained to ask and respond appropriately. Third, provide ongoing staff education. Include ADA basics and disability sensitivity training during orientation and annually. Role-play real scenarios to build confidence. Finally, engage with the disability community. Involve people with disabilities in advisory boards or patient feedback groups. Listen to what accessibility means from their perspective. The ADA is more than a checklist, it's a commitment to equal care for every patient, every time. Healthcare that's accessible is safer, more effective, and more human. Have you worked to improve ADA compliance at your facility, or had an experience that highlights the importance of accessibility? Share your thoughts in the comments. Like this video? Give it a thumbs up. Subscribe for more healthcare education, safety, and inclusion content.